Nothing in this podcast is intended as investment advice, and the people in this podcast may hold positions in the stocks they talk about. Do not buy any investment based solely on a tip or recommendation. Please do your own research.
Hello and welcome to the Sunday Roast. It's Sunday the 13th of July. I'm Phil Carroll.
Kevin Hornsby.
What a week, Kev. I've been loving the sunshine. What have you been up to? How's it been over there?
It's been nice. I was at the Mediterranean, and I came back to Cairo a couple of days ago, and it's stinking hot here, and AC's working on full blast. Out at 6 o'clock for a swim to cool down, and
It's been a bit scorchy over here. I mean, literally, as I think you're right. I think the thing to do is get up early. You know, the 5 a.m.ers, because you can't do anything after 9 o'clock. I mean, I went to Oasis last week. That was a sunshine reference, but unbelievable gig in Cardiff. They're sort of, you know, the reunion gig. I think it's 40 dates or 41 dates that they're on now. 5 of them they started on Friday at Heaton Park in Manchester, so it's sort of their homecoming, as they called it. But I didn't have much expectations. I had quite low expectations of the brothers, the voice and everything, because I'd seen Liam previously on a solo, and his voice wasn't particularly in form. But actually at Cardiff on the first night, you know, both of them were, you know, the voices were excellent. The band were really good. Bonehead was there. They had a new drummer, a session drummer, Veronica, I think, who's done session drumming for sort of Pearl Jam in the US. So, but yeah, they were really good. They rocked the stadium. Everybody said it was an incredible night. They had support from Richard Ashcroft from the Verve. They did all Bittersweet Symphony. So yeah, really good to see them back in fine form, and people were buzzing. It was like some people said it was the best night of their lives. So really, really good.
Yeah, good. They must have had a pretty sad life if that was the best life night of their life. But anyway, it's like. Yeah, I mean, it's great to see them actually talking to each other, which is positive.
They came out. Noel was a bit subdued at first, but they came out holding hands, and then they had a hug before they went off, which, you know, obviously everybody was reading the body language. But Noel did a really good section in the middle. Like Liam gave his voice a rest, and Noel did about 3 or 4 songs, like Fade Away and a few of the others. But yeah, it was really nice to see them sort of look like they were gelling together. Although Liam left pretty sharpish in a Range Rover, and apparently Noel rocked in. He actually came in by train. He doesn't drive. He's bought all these cars, but he's never passed his test. So it was interesting to see him rock up by train.
It's sort of probably easy to love each other and smile when you're making £1 million.
Yeah, 50 million out. They reckon 50 million each, and then they also negotiated a 20% cut on the food and drink from all the venues as well. So not a bad deal if you can get it.
Yeah, absolutely.
But let's have a look at some of the news stories that have dominated. I mean, the big one really in the UK has been the Starmer and Macron striking this one-in, one-out migration deal, where Starmer and Macron have agreed to trial a one-in, one-out scheme for Channel boat crossings, returning illegal arrivals to France while allowing safe route asylum seekers into the UK. Obviously, tensions remain over deterrent efficacy on that. So what do you make of that? I mean, obviously, Macron came over. He came in. He was in the House of Commons. He addressed the whole of the government. And yeah, obviously, this is an interesting trial. I mean, I think the idea is that they're going to effectively deport any illegal arrivals, or, you know, anyone who's arrived illegally into the country, and then swap them for, you know, people who are genuinely seeking asylum into the UK, you know, whether they've got relatives here or whether they've got a genuine reason to escape the country that they're seeking asylum from. What do you make of that? Is that possible to do? Is that impossible to
I'm sure it's possible, but deport them to work back to France?
Back to France, yeah.
Okay. I mean, it seems very plausible, but at the same time, probably almost impossible to actually achieve. What does that mean? Does that mean all the people who are trying to legally come are going to be paying for people to try and get over so that they can swap them? It's bananas, isn't it? And it's actually not going to stop migration. The whole point is to stop people coming in. And if that is the point, then swap them one in, one out. I mean, hopefully that means people will stop coming because they know they'll be deported, so therefore it will stop.
Yeah, if they know they're going to be pushed back. Yeah, exactly.
I don't know. I mean, I'm sad to say it, but from what I'm seeing from a distance, the UK's in tatters, basically. It's falling apart.
Yeah.
You know, and I think Reid Reeves is about to announce big tax rises again. I don't think she can do anything else if she wants to keep within her spending limits. The UK economy in May shrank, which wasn't exactly a good sign. And yeah, it's a bit miserable. Yeah, we've got the US basically. I mean, we said it last week on Rick Rule's podcast that I just think the US is sleepwalking into a disaster. They're just printing money, handing it out, and hoping that all that buoyancy is going to work. If they don't reduce interest rates, they're going to be a big problem. We've seen it this week we've seen Bitcoin rising, we've seen gold rising, we've seen silver rising. Silver's starting to go on a bit of a why, because they're seen now as solid alternatives to the US dollar. And yeah, I don't know what's going to happen. Maybe we'll talk about that more later. But yeah,
for sure. No, I agree. And then there was a development on Friday. They talked about. Do you remember this Air India crash? This flight 171. It was a Boeing 787-8 Dreamliner from Ahmedabad to London. They did a preliminary sort of investigation release on that. What they found is that the fuel cut off, or there was fuel cut off to both engines seconds after takeoff. The both engines' fuel control switches were unexpectedly moved from run to the cut-off position, which obviously caused both engines to shut down. On the cockpit voice recorder that captured a passenger asking the other, or not the passenger, but effectively they don't know whether it was the co-pilot or the captain asking the other, "Why did you cut off?" And the response is, "I did not," confirming pilot uncertainty. So I guess the questions on that or around that now are, was it human intervention, somebody who actually meddled with the switches, to actually shut down the fuel pumps, that effectively moved them from run to cut off? Not looking good, is it, on that one in terms of preliminary?
It's a bit bloody scary that the pilot can just do those two switches and bang, the whole thing's just going to die. Yeah, it makes me want to trust the pilot a bit more. But yeah. Absolutely scary, that these things can happen. And I mean, I suppose for most people anyway, we didn't really talk about it much, but for most people, our ability to be alive has been questioned by Diego Jota getting in his Lamborghini and not being here anymore.
Yeah.
People are sort of questioning their life, because any of us can jump in a car.
Absolutely don't know. Yeah, you're absolutely right. I've talked about that at length a lot this last few days, and I just, it does make you you're not worried, but you don't know. I mean, if it is exactly what they think. I mean, again, they've done a preliminary release on that, and they've said that the Portuguese and Spanish officials have said that it potentially was resulting from a blowout on his Lamborghini, and ultimately, 100 meter skid mark from the road to where it left the road and ended up on the verge. And if you rupture a fuel tank in a vehicle like that, it's game over, literally, and especially if you're not carried. I mean, there was a crash at the Nürburgring last week where a GT3 RS was coming through on the left, and then there was a British M2 car, and the M2 moved into the path of the GT3, and he clipped him, and they both got spun into a barrier, and the fuel tank was ruptured on the GT3. But luckily, they were pushed forward, free of the wreckage. What affected the fuel tank, effectively detached from the car, and they both survived. But in the sense of Jota, I think they were effectively pinned under the barrier, and then the fuel tank went up around them. You've no chance.
Yeah, no, horrendous, absolutely horrendous. But on a more positive note, let's move forward.
I mean, so
don't drink too much beer just while you're thinking, and have a think about what our next guest is about to tell you.
Yeah, absolutely. And a quick one before we get going, make sure you subscribe, give the episode a like, and hit the bell icon so you get notified the second a new one drops. And as Kev says, we've got an action-packed show this week. So let's move on to our first guest. Today we're diving into one of the most under-the-radar stories in biotech, a company called SVNS Therapeutics, which could be on the cusp of transforming addiction treatment while delivering serious upside for early investors. With a market cap of just £20 million and a phase 3 trial underway, it's caught the attention of our resident analyst, Charles Archer, who's written about it in his latest Substack article. Joining us is Anthony Tennyson, CEO of Solvonis, to talk us through the company strategy, its ethical approach to addressing addiction, and what lies ahead as they move towards commercialization. Welcome to the roast, Anthony. How's life?
Hey guys, good to talk to you. Life is good. It's a pleasure to chat with you guys and the audience today.
Absolutely, yeah. So, Anthony, tell us in a nutshell what it is that Solvonis does.
What we are doing is we are developing new and potentially more effective medicines to treat large problems that face many, many millions of people today, and that is addiction and mental health. We've got a near-term focus on alcohol use disorder and post-traumatic stress disorder. And really the reason that we're focused on those issues is there's been a lack of innovation by big pharma in the treatment of addiction and mental health over the last decades. And specifically for alcohol use disorder, there's very few effective options available for the millions of people in the UK, the EU, and the US whose lives are destroyed by this disease. And listen, guys, I'm Irish, so I know what alcohol does to individuals, to families, and to communities. And our real purpose is to provide hope for those individuals, families, and communities whose lives are destroyed by this disease and who are very poorly served by the pharma industry today.
Yeah, absolutely. So Solvonis began life as, I believe, as Graph Polymer, and I think they were a company that were focused on what I would call drug delivery technology. So what was the driving force behind the pivot towards mental health and this, the addiction treatment, the alcohol use disorder that you just referenced? Was there a moment that made that shift feel inevitable?
Yeah, so Graph Polymer was actually primarily an industrial plastics business with about a third of the business focused on using biopolymer plastics to improve the delivery mechanisms for medicines. That business hit financial difficulties late 23, early 24. I came in as the chief exec in May of 24, took a look at the business and understood that the real potential for businesses like Graph Polymer was really in addressing these large acute or large chronic issues facing the medical system today, which is mental health and addiction. So we brought in some new investors, we restructured the business, we exited the low potential industrial plastics business, focused purely on healthcare and biotech. So refocused, restructured, recapitalized the business Q2, Q3 last year, and then we rebranded the business early this year. To really help us accelerate our agenda, which is to change how addiction and mental health is treated, we acquired a Canadian biotech for a very good value as far as we're concerned. And that's really helped position Solvonis Therapeutics from the legacy industrial plastics that was Graph Polymer into a leading position in the UK, EU biotech space, focused specifically on those large, chronic, underserved issues as mental health and addiction.
Absolutely, yeah. And then obviously earlier on in the year, you announced the acquisition of, was it Awaken Life Sciences? What made that acquisition work? What was it the right fit, and what unique value does it bring to your sort of, your current pipeline, both clinically and commercially?
Yeah, so from our perspective, it was a really, really good value transaction for us. Awaken Life Sciences was a leading company focused on addiction and mental health, listed on the Canadian markets, was performing very well. At its peak, it was valued at 80 million Canadian, which is about 45 million sterling. That was in early 2022, and the king for biotech companies. So Solvonis was able to acquire that company for, depending on the share price in the day of the transaction, between 3 and 5 million sterling all paper. And that company has some really, really interesting and exciting assets. It has 2 programs in the clinic. So its lead program was that phase 3 program you mentioned at the beginning, focused on severe alcohol use disorder. The results in phase 2 were groundbreaking, Phil. And I don't say that by trying to inflate the thing in any kind of way. People coming onto Awaken's phase 2 trial for severe alcohol use disorder, they were sober 2% of the time. That means they were sober 7 days a year, right? If you think about the impact that has on the individual, the family, the community, but really on the individual's system's health, and the total cost to the individual, to the payer, and to the healthcare system for the rest of their life, that's quite material. And those that went through the active arm of that the trial in phase 2 for Awaken's lead program achieved on average 86% sobriety in the 6 months post treatment. That's unheard of from a change from pre to post, but actually as an outcome, again, it's unheard of in the treatment of alcohol use disorder. And they have some other assets, so it wasn't just a one-trick pony or a one-shot-on-goal company. So we completed the acquisition of that company in the very end of May of this year. And that has, as I said before, that's now propelled Salvonis into what we believe to be a leading position in the UK biotech space, but also the European biotech space in the development of innovative, effective medicines for treating large chronic problems. And what's really important for us, Salvonis, as a UK incorporated LSE listed company, is that phase 3 program. And this is what wasn't resonating in Canada for Awaken. That phase 3 program is being executed as part of a partnership with the UK Department of Health, funding the majority of the costs through the National Institute of Health and Care Research, the NHR, and the Medical Research Council, the MRC. Really importantly, it's been delivered in the NHS, in 8 NHS England Trust sites, which means about 60% of the key opinion leaders in the treatment of alcohol use disorder in the NHS in England are actually involved one way or another in that trial. So this is now, Salvonis is a UK company, UK listed, with a lead program that is being delivered in the UK public healthcare system, supported by the Department of Health, with the potential to change how a disease like alcohol use disorder is treated. And again, all of this is to provide hope for the individuals, families, and communities whose lives are pretty negatively affected by this disease and are poorly affected by the pharma industry, but also with potential, we believe, to create some significant value and upside for those early stage investors, as you mentioned at the beginning, Phil.
Yeah, and obviously sounds very promising. As I alluded at the beginning there, it obviously caught the attention of Charles. So he actually wrote a very in-depth article, which I'm sure you've read, Anthony, in his latest Substack. So I'm going to hand over to Charles and give him the floor now.
Wonderful, wonderful. I think we could probably spend the next 6 hours talking about this. Do you know, obviously you're working with the University of Exeter. I'm literally a stone's throw away. It's my alma mater as well. But, you know, yeah, genuinely, yeah. But law and history and politics and, you know, all sorts of verbal things, as you might imagine, rather than science, sadly. Yeah, I mean, let's talk a little bit about phase 3, because these phase 2 results, you know, 86% versus 2% is exceptionally high. I think no one's arguing that. But now we're looking to, you know, phase 3 and what you're doing at the moment. And I guess the question is, what are you doing to validate these findings in phase 3, especially considering that potential for patient self-reporting bias?
So we have designed the clinical trial. The clinical trial is designed in exactly the same way that all trials for alcohol use disorder are designed in the UK and in the US.
Right.
And that is a trial design that has been accepted by the MHRA because they provide approval for the trial before you are able to begin it. And it is self-reported. It is people self-report their alcohol consumption on a regular but intermittent basis post-treatment. And that is the standard, that is the gold standard for how alcohol use disorder trials are designed and executed, as I said, under the guidance of MHRA for here or the FDA for the US.
Good answer. Sorry, they're kind of like pointy questions, but I think when you get to phase 3, the questions get pointier, don't they?
They do.
Yeah. As it is funny, isn't it? Because in phase 2, there's a significant amount of, well, you're trying something new, aren't you? And you don't know. Whereas now it's very, very exciting. When you're conducting the psychotherapy during this ketamine, you know, you call it a window of enhanced neuroplasticity, right? So yeah, I would say kind of maybe a risk maybe isn't the right word, but, you know, when you're talking about designing the trial, what are we doing to ensure that the therapists are adequately trained and consistent in delivering what is your proprietary care psychotherapy? And how do you quality control for the therapy delivery?
Yes, so that's a great question. So for your audience, what we're doing is we have a dual track R&D approach. So we're repurposing approved drugs, but we're also developing our own compounds or drug discovery from the ground up. So the repurposing de-risks, reduces cost, reduces time, and then the NCE, so the new chemical entity development, provides long-term pipeline depth. So for that lead program, what we're doing is we are repurposing racemic ketamine as a novel combination therapy, so drug and therapy together, and we're directing that a new indication. So racemic ketamine is approved in the UK and in most territories as an anesthetic and as an analgesic, as a painkiller. It's actually on the WHO list of essential medicines, so it is accepted as safe. So one of the biggest challenges in drug discovery and drug development is safety. So we have de-risked this by working with a drug that is already, or a medicine that is already approved, and we understand that it's safe. So what ketamine does, or how we deliver ketamine, is we deliver it as a combination of drug and therapy together. 3 ketamine infusion sessions where we deliver ketamine at a sub-anesthetic dose, and we pair that, or we wrap that in a course of CBT, cognitive behavioral therapy based relapse prevention therapy. So what ketamine does, and that's very relevant in the treatment of addiction and alcohol use disorder, is ketamine gets the brain into a state of neurogenesis. So it gets the brain goes back into the state that it was at when we were teenagers, where all the new neurons are forming. And if you have your therapy in that time of brain elasticity, the learnings that you gain and the insights you gain and the defense mechanisms that you gain to prevent relapse are laid down at a much deeper level. So it's why the memories that we have from being teenagers are much more impactful on who we are as a person and our personalities than anything that us old farts experienced in the last couple of years or months.
Well,
the second thing that ketamine does is ketamine interferes with memories, and memories are dynamic. As you re-experience a memory, it's called out of the memory bank. You interfere with it as you re-experience that memory and it's laid back down. An awful lot of the reason why people relapse is triggering memories. So it could be the memory of the future reward delivered by alcohol. So it depends upon why you have become addicted, but are you seeking oblivion? Are you seeking escape from trauma that you have experienced on other people through the guilt? Like, the process of becoming addicted is a traumatic process because you tend to have destroyed a lot of things around you. But also there's a lot of triggering memories. So again, if you use the therapy in combination with the ketamine experience, those memories are brought to the surface beforehand. Ketamine interferes with them, and as they lay back down, they become less impactful on your personality and on your life experience. And the third thing that ketamine does is there's an out-of-body experience, locally, a trip. When people take ketamine recreationally, you often hear them say they end up on the ceiling looking down themselves in the here and now. Because we compare ketamine with therapy, that out-of-body experience actually gives people a different perspective. And again, a lot of alcohol addiction is driven by trauma. Abuse inflicted on the individual when they were in their formative years as teenagers or children or early adulthood, or the trauma that they've inflicted upon other people, and why they seek to hate themselves and they seek oblivion, they seek to numb the pain. So if you pair your ketamine experience with therapy, that out-of-body experience can remove your perception from yourself and give you a different perspective, which can enable you to forgive other people, but really importantly, forgive yourself, and enable you to potentially move on. So that's why it's the drug and therapy together is really important. What we're doing is novel. We're the first company to use that drug and therapy together for ketamine for the treatment of alcohol use disorder. But there's a challenge in delivering therapy, because how do you ensure consistency with the therapy?
Yeah, exactly.
If the therapy is consistent, right, you've got a complexity around how do you train people to ensure that there's a consistent experience delivered to the client or to the participant in the trial. But let's face it, when we want to get this approved and we have this in the real world, in the hundreds of addiction clinics that exist in the UK and the EU, and the thousands
in a compressed time scale with thousands of patients potentially. Exactly.
Correct. So Professor Celia Morgan, in your alma mater, who's head of department in the University of Exeter and is the innovator behind what we're doing here, she recognized a couple of things. She recognized that there is a shortage of supply of appropriately qualified therapists, certainly within the UK and the EU healthcare system. That there is a challenge around clinical trial design to ensure the therapy is consistent. And you also need to be very efficient with your use of resources within the healthcare setting to ensure there's no friction and resistance to adoption. So very cleverly, she designed a 120-page therapy manual that's copywritten and that there is no deviation from. And it's CBT, so it's a relatively narrow swim lane. And so that ensures that we can train therapists in a very rapid period of time, which is helpful for the clinical trial design, but thinking forward to ultimate commercialization and delivering this within the healthcare environment, not to use too many economic terms, but we need to ensure there's a minimum opportunity cost to the healthcare setting to take people offline to train them.
Yeah.
So that's the whole thing is designed with the eye of trying to ensure that the therapy is consistent, because that's what the regulators for clinical trials want.
Yeah.
To ensure that it's efficient in the use of assets and resources within the healthcare setting, and that it's easy to train people so that there's minimal opportunity cost. But really importantly, if we can deliver the therapy, if the therapy can be delivered efficiently and consistently, there's a relatively lower qualification barrier or hurdle to jump over. That means there's more therapists. Because there's more therapists, it means it reduces the cost, and invariably there's churn for healthcare setting, healthcare employees, etc. And you don't want to have to incur massive costs to retrain people all the time. So we've thought of all of that. We've worked with the University of Exeter, we've worked with Celia to ensure that this has the highest probability of acceptance once it is delivered, subject to us being successfully completing the phase 3 trial and being successful in applying for marketing authorization in the UK and in certain EU territories. We want to ensure that this is as easy to be adopted and deployed within the healthcare environment as possible.
Yeah, you answered a lot of questions, and it's nice that you covered all the bases, because rather than having to drag it out of you. But I guess the question is, if the phase 3 is successful, I guess there's a two-part question. The first is, you've talked already about, pipeline expansion. So for depression, for example, or stimulant use disorder, and potentially, multiple different mental health conditions, you could try it out on some, possibly with more success than others. So that's the first part of the question, is where do you want to go next, assuming the phase 3 trial works? What do you want to focus on first? And the second is the pipeline in terms of where you see a trial going and potentially future trials over the next sort of 2 to 3 years, and then commercialization. Assuming it's all successful, what does that look like?
Yeah, that's a great question. So the approach we're taking with our lead program, SVN001, where we're repurposing racemic ketamine in combination with copywritten manualized relapse prevention CBT therapy. We are targeting that in the UK and the EU market only. The reason that we're doing that is in the UK and EU, when you repurpose a drug as a new combination therapy and point at a new indication, you can use something called a mixed full application, and that's just how you apply for approval to market the drug. In the UK and EU, it's possible to secure 8 to 10 years regulatory data protection for your application. So for us, we'd have phase 2 and phase 3 data specific to the indication. If we are successful, no other company could reference our data in applying for marketing authorization for their own version or their own brand of ketamine to treat alcohol use disorder, which means we've got 8 to 10 years to build a marketplace and to create value for the company and for shareholders. And when you think about the timelines that are available for pharma when they develop their own molecules, they typically have to file a patent very early in the process. It can take many years before they're actually in market, and then they only have a very relatively similar timeline available to build a market.
And then the risks are much, much higher as well. New molecules, less than 1 in 10, maybe 1 in 20 realistically.
Realistically. But that level of protection, and then back to your question about the pipeline and what's next, that type of protection isn't available in the US. And the US is the real goal for companies like us.
Yeah.
To put that in context, there's 29 million people suffer with alcohol use disorder in the US. There's about 1 million in the UK. There's 15,000 clinics in the US treating alcohol use disorder. Direct cost to the healthcare system, of about $25 to $35 billion a year. So it's a big market, big opportunity. But that level of data protection isn't available in the US. So we need a different approach. So our secondary program, great name, SVN002.
No. It is a great name, because so many companies like to make it way more complex than it needs to be. But go on. 1, 2, 3. Perfect.
Yeah, exactly. You can see a pattern here. So we've in-licensed, so S-ketamine, not to get too sciencey on it, but there's a right and a left hand in many molecules.
Chirals, yeah.
Yeah, the S-ketamine is the left enantiomer. We believe that's the more potent one for what we want to do. We've in-licensed a phase 1 program from a German pharma company where they've repurposed or repositioned that drug into an oral thin film for sublingual and buccal, so inside the cheek delivery. To put that in context, Johnson & Johnson launched a repurposed Spravato for depression, and it's a blockbuster drug now. It's called Spravato. So we're working with that for the US market. So that's our secondary program. We had a meeting with the FDA in December of last year. They have supported us. They agree that we can cross-reference into J&J's Spravato product as doing a 505(b)(2). So that's a repurposing program in the US. They've agreed that we don't need any further human data. Once we've established a scientific bridge into J&J Spravato, they agreed we don't need any further human data before going into phase, or they are supportive of us not requiring any further.
I'm going to correct you.
Before going into phase 2B. So that enables us, that means we're in phase 2B planning. So we're in phase 3 for an asset for the UK EU to de-risk and to provide us with another shot on goal. We're in phase 2B planning for an asset for the much larger, more valuable US market for moderate to severe alcohol use disorder. But then adding on pipeline depth, we're developing our own molecules for another chronic disease that lacks innovation and for with no current medicines licensed to treat it, which is post-traumatic stress disorder, which again affects millions of people in the US, the UK, and the EU. So we're developing our own molecules. It's earlier stage, it's preclinical, but it has we believe, decent potential. And with that, what we're doing is we are modulating the serotonin, dopamine, and noradrenaline receptors at the brain level. It is now understood that if you can modulate those receptors correctly, you can ensure people can engage more effectively in therapy. So it enhances pro-social responses. The only way that you can really treat PTSD is through talk therapy. The body reacts the same way to reliving the trauma as it did when it first experienced the trauma. Unfortunately, the majority of cases and reasons why people develop PTSD is not actually the battlefield. It's sexual abuse during your formative years.
Yeah.
And if you think about trying to relive that experience with a talk-based therapist, that's distressing. And the fight or flight response kicks in, the brain shuts down, you tend to leave the room. So if you can dampen down those responses and engage more effectively in therapy, you can potentially have a way to more effectively treat PTSD. So we're feeling positive about that. The science and that is led by our Chief Scientific Officer, World Authority, Professor David Nutt, who works with us half-time and then works with his head of department in Imperial College. And then we've got some earlier stage stuff. We just restarted an AI drug discovery program that Awaken had paused it. We've now restarted that within Salvonis, and we are exploring discovering and developing drugs for other chronic diseases, specifically depression and also substance use disorders, or I beg your pardon, stimulant use disorders. The reason for depression, again, our purpose as a business is to develop medicines to more effectively treat large chronic diseases, and depression is one of those. And then for stimulant use disorder, the reason that we're particularly interested in that is there are very few drugs currently licensed for the treatment of stimulant use disorder. So that, Charles, would be methamphetamine, so crystal meth, and also cocaine. But in the US, now there's a lot of volatility in the US right now, but there is a certain amount of non-dilutive state funding available for people researching methamphetamine addiction because there's nothing currently available.
Yeah, well,
that's us in a nutshell. Pipeline depth, 2 programs in the clinic, other programs in discovery, all of which are focused on large diseases where the populations are currently underserved. So there's a significant unmet medical need, large addressable markets, and therefore we believe there's a significant commercial opportunity for companies to innovate in that space.
But this is the thing, because you already have significant funding, UK government, University of Exeter, all kind of piling in, along with a couple of others. Pharma Ventures, was estimating the total deal value of maybe £60 million for SVN 001 and then 150 million for SVN 002. So 1 in the UK and EU and 2 in the US. But when we're talking about these total deal values, we're talking about upfront payments, various milestone payments. regulatory approval, first commercial sale, for example. And then this pharma ventures valuation, and correct me if I'm wrong, because this is just my opinion, but it doesn't account for potential superior efficacy profile of 001. So how does that translate potentially into a higher deal value? And I guess, tagging on to that, I'm sorry, it's quite a long question, like rounding a little bit, but delivering phase 3 trials, even though it's a much lower cost than a typical trial, is still expensive. So I guess the question is, where are the trade-offs when it comes to getting a funding partner?
Yeah.
When you're trying to bring something to commercialization.
So great question. So our business model, and listen, we're small, right? We have ambitions, but we are small. And recognizing that we're small, our business model is about progressing research programs to a certain point and then seeking to license them to larger players. That's the business model. So to aid that, earlier this year, we retained a UK-based biotech in and out licensing advisory company called Pharma Ventures. They're leaders in their field, and we are working with them to identify and to execute and identify out-licensing partners and to potentially execute an out-licensing deal for our lead program 001, which is that asset that's in phase 3. So as you mentioned, comparable transactions in the same space, so in addiction or mental health, for an asset in phase 3, repurposed, focused on UK, EU, could typically earn somewhere in the region of 60 million sterling in transaction or deal payments. So that would be payments on signing, milestone payments as further objectives are achieved, so completion of the trial, success of the trial, marketing authorization 31, 32, 33, etc. And then in addition to that, there would be royalties on future sales. Now, what those percentage royalties are depends upon the results of the phase 3 and how successful it is, but also, on things like what's the potential margin, etc., for the asset. So all of this is still under negotiation and in discussion. We're in discussions with a number of mid-tier pharma companies, but nothing is signed and nothing is announced. For the US, given the US market is much larger, an asset such as the 002 asset, if it is successful in completing the current planned phase 2B trial, an asset like that comparable assets would have earned 150 million sterling in deal payments. So again, signing and milestone and future royalties. And the size of the future royalties, the percentage of the future royalties, again, is dependent upon how successful the phase 2 is and how successful whomever you license it to believes it would be.
So, okay, phase 2 showed 86% abstinence, which again was remarkable. I think current treatments, which don't, in my view, don't particularly work. If you talk to anyone who's ever tried to, deal with this with alcohol use disorder, it's not working. But I guess the question is, if phase 3, if it does better than 86%, fantastic. If it does the same, fantastic. If it does slightly worse, I guess the question is, at what point do you view it as a success / a failure? If it was 50%, it would still potentially be standard of care, wouldn't it? Or 60.
Well, current standard of care is hard to measure, right? But the best research currently available indicates that 75% of people relapse within 12 months post-treatment for alcohol use disorder, and then unfortunately, many of those people go back to drinking more than they did before. So there's a reasonably large goal for us to aim at to beat current standard of care.
Yeah, which is a horrible thing to say, but also it does mean that the risk is potentially lower, especially since you're repurposing, a drug that already exists.
Yeah, correct. And I think what's good, what the audience maybe or your audience might want to consider if they don't already, is I think you alluded or you said it earlier on, a phase 3 trial, the phase 3 trial that we're running in combination with the University of Exeter and Department of Health and the NHS. It's a 280 person active placebo, 2-armed active placebo controlled trial. A trial like that in the UK, pick the number, somewhere between 10, 20, 30 million sterling to run a trial like that. In the US, different order of magnitude. The total ticket price for the trial, is 2.25 million sterling. And the reason for that is because it's been run in the NHS. The University of Exeter is acting as the CRO. And so the costs are significantly reduced. And for us, again, in our attitude, our laser focus on being strict on how we spend our capital, seeking to de-risk what we do, because we're inverted commas only co-funding, our costs for that phase 3 trial are capped at 800,000 sterling. It's paid out evenly over the next, like it started a while ago and through to when the trial completes. So it is a very unusually low price for a phase 3 trial. Very helpful, obviously, for us from a burn perspective, but also from a shareholder value creation perspective. It is unusual that a company of our market cap is in phase 3. And the reason for that is because of the very favorable transaction and support that we were able to secure with the University of Exeter and Celia, Professor Celia Morgan, and also the NIHR and the MRC.
I guess this is the last question for me. Again, we could talk about this for hours and hours, but people have limited time. So this is just about, talking about patents, right? So your moat is more about regulatory approval, clinical execution, treatment IP, rather than kind of molecule exclusivity. So I've compared it to Spravato simply because they took this known compound, esketamine, and delivered it intranasally for treatment-resistant depression, and then combined it with an in-clinic monitoring protocol, an antidepressant. And esketamine wasn't new, but Johnson & Johnson still secured patents on the delivery method, on the dosing protocols, on the clinical use. They got FDA approval, and I think that's a $700 million annual product now, roughly.
My understanding is if they haven't already, but when they put their numbers out for 24, I understand it will be a blockbuster drug. So that's north of $1 billion in revenue.
North of $1 billion. We're splitting hairs here with the market cap where you are. Basically, I think like the key perceived risk among kind of retail investors is that the patents or synonym for patent that you might be able to put the moat around your treatment / use of esketamine or ketamine. How strong is that moat? How difficult will it be for other companies to break through it compared to a novel drug?
Well, so for the lead program one, it's a regulatory protection strategy that we are pursuing, and that we will be seeking a mixed full application in the UK EU, which will provide 8 years regulatory data protection on our phase 2 and phase 3 data in the UK, and if successful, 10 years in the EU. Now, what that means is that a generic provider, so a competing product, would need to reference our data in order to apply for marketing authorization for their brand of ketamine to treat alcohol use disorder. And they wouldn't be able to do that for 8 to 10 years, which is half the lifetime of a patent. But the patent clock starts way earlier, way before you apply for your authorization. So they're in the same range, significantly de-risked, and a massively reduced cost to us as a company. And we believe that's a pretty good strategy. And there are lots of pharma companies out there that make quite a lot of money from repurposing already approved drugs. So it is an established methodology.
Excellent.
For the US market, your point is really well made about J&J and Spravato. Esketamine is well understood. They have inverted commas just repurposed it from whatever way it was delivered as an IV anesthetic into an intranasal spray. And they've turned that into a very good business. We are repurposing esketamine into an oral thin film, so oral delivery, or sublingual delivery, buccal delivery instead of intranasal delivery. The company that we've partnered with have filed formulation patents. We've actually tested that drug product in humans in the University of Exeter, which has enabled us to file method of use patents. So the IP moat around our 002 program is not hugely dissimilar to what the multinational J&J have done, and they have turned that product into a $1 billion, when the numbers come out for 24, product. So what we like to think of, certainly when we speak about this internally, is if people like the sales curve for J&J's Spravato, you might be quite interested in what we have planned for 002. And why I think that's really the case is J&J had to make the market in the use of esketamine for the treatment of depression, in the fact that their clinics weren't really set up for that kind of delivery mechanism, because you come in, esketamine is administered nasally, and people have to wait for an hour and a half to 2 hours under observation. If you look at the addiction market in the US, as I mentioned in the first part earlier on, there are 15,000 clinics in the US treating alcohol use disorder. 80% of those are treating people with drug and therapy in one shape, form, or another, and the relapse rates are 75%. So we believe the market exists, the distribution platform exists for what we're looking to do, and the precedence exists as well with what J&J are doing.
Okay, I had that was my final question, but I've got a new one now, and then I promise the last one.
No.
I've got to. It's more like a moonshot question, but I guess. Okay, let's fast forward, end of phase 3 trials. You've put the data out and it's all fantastic. Within a few percent, it's replicated what we've done in phase 2. Are Johnson & Johnson, in your view, the most likely, company to partner with you for the longer term or to, potentially buy out these therapies? Or is that something you don't want to comment on yet? It's just because their expertise.
Don't answer that, Anthony. Whatever you say, don't say a word.
Come on, then we're going to clip this to Twitter.
I couldn't say that
couldn't
way.
Possibly say. What a
couldn't possibly say. No.
Yeah.
Is your name Kevin Charles all of a sudden or what?
There are other companies out there with reasonably decent market caps listed on fairly chunky exchanges who have an interest in addiction. From what I know, J&J do not have a specific interest in addiction. But I think what's really important for the audience to understand is the pharma companies are facing something called a patent cliff.
Yeah.
So a lot of their stuff that they're earning a lot of money from is about to come off patent. And they are seeking to rebuild their pipelines. And what I would encourage your audience to do is to look at some of the recent blockbuster, and I mean big blockbuster, north of $5 billion transactions in the pharma industry. A lot of that has been in mental health, in CNS, in neuroscience.
Yeah.
J&J took out Intercellular, I think, in January of last year for about 13 billion.
Yeah.
Lundbeck took someone else out for 4 or 5 billion. Bristol Myers Squibb took someone else out for 12 billion.
There's a website, isn't there? Well, I know there is. I've got a bookmark. Can't remember off the top of my head, but the activity is just crazy. Just more generally.
It's in a lot of this is in CNS and in behavioral health. And what sets us apart from a number of other companies in this space is not only are we really lean, mean, and efficient, but my chairman, Dennis Purcell ran the healthcare franchise for an investment bank in the US called Hamburton Quist. Hamburton Quist was bought by JP Morgan. There is the biggest gathering of biotech and pharma people in the world. It's called the JP Morgan Week. Dennis set that up. It was called the H&Q Week. When Dennis was in biotech and banking, he was responsible for between 10 and $20 billion in financings across the biotech, pharma, and health and medical devices. He set up his own VC shop called Aisling Capital. It's Ashling Capital, but the Americans call it Aisling Capital. Well, that's $2 billion funds deployed. So if there's anyone that knows whom to speak to in those very large shops when the time is right, it's him. And then our science is run by Professor David Nutt, who I said before, he's one of the top 3 researchers in this field globally. So there's a lot of things that we have set up that set us up, we believe, quite well.
So, Anthony, let's get down to the real stuff. Solvanus, where does the name come from?
We want to solve large, chronic mental health and addiction issues that are currently poorly served by the pharma industry.
Okay, so that's where you came for Solvanus. Okay, I'm intrigued. When you want to expand the size of this, how is the CBT going to be delivered? As in, are we talking about therapists, or are we talking about systems that they use on a computer, or how will it work?
Yeah, so for the 001 program, it'll be therapists in clinic. So specialist clinics, treatment cycle or referral cycle, one would go to one's GP, one would be referred to a specialist addiction treatment clinic. And within that specialist addiction treatment clinic, there would be a doctor who would prescribe 001 or whatever the brand name ultimately is. And then it would be a combination of drug and therapy delivered in that clinic with the goal being the therapy is manualized, it's copywritten, we can train people pretty efficiently. So a number of days we can train therapists to be able to deliver this therapy package. For the US, in the US, what we understand is all about securing payer acceptance. So in the UK, the payer is the NHS, and NICE decides whether or not the NHS can prescribe your product. In the US, it's slightly different. You need to secure, not to get too technical, but you need to secure CPT codes. And those CPTs, they're the billing codes. So what we are designing this, our 002 program, we're designing that to be able to use similar or same CPT codes to J&J, Spravato. And so because of that, the therapy package will probably be digitizing it and for consumption at home. And that just is something we believe will be more efficient within the healthcare setting in the US, therefore have a higher probability of acceptance by payers and a greater commercial traction.
Yeah, I think for you to go very big very quickly, you're probably going to need to train quite a few therapists if this is the numbers that you're talking about, because the therapists aren't in that number. I know it's only short-term therapy, but even so, how do you anticipate that you will cover that situation off, or will that not be your problem?
Well, if it has anything to do with commercial growth, it will ultimately be our problem, or what I believe to be, it'll be our opportunity. So addressing the reasonable bottleneck or being aware that there is a bottleneck around the availability of therapists within the UK and the EU setting, that's why we've manualized the therapy. So it's 120, 130 page therapy manual. It is relatively easier for a therapist to deliver this therapy package because it is a therapy manual. Because of that, there is a relatively lower bar or a relatively lower experience required to be able to deliver this. Because of that, there will be relatively more therapists. Because of that, they will have a relatively lower unit cost.
So you've given them a rail track to run, basically, is what you're saying.
Yeah, a relatively narrow swim lane, I think, is probably is a good way to describe it, or a good analogy to use.
Okay, very, very good. And I'm very interested about the PTSD as well. I mean, undoubtedly, it's mental as well as obviously the chemicals that you're going to give them. But how soon do you think that the PTSD side of things will move forward in terms of the stages as well?
Yep. So where we are with that right now is we have 6 co-lead series, or six molecules that we are assessing to determine which one is going to be the lead. And we would hope to have that lead identified this summer. I'm hoping for end of July, but it's summertime and there's some scientists on holidays, etc.
There's lots of people drinking, hey?
It's been developed. The testing is happening in Italy, and so there's a lot of Italians on holidays at the moment.
On red wine,
so,
yeah.
Okay,
so we'd hope to have the lead identified and announced this summer.
Okay, so you're appearing for the first time on the Sunday Roast, so we have to ask you our question. So the question is, what is the Sunday Roast in your household?
The Sunday roast in my household is usually, it's me cooking it. It's either a slow roast shoulder of pork or a slow roast shoulder of lamb with gravy that I labor over for 12 hours, served with, if it's lamb, it's served with salsa verde. And if it's pork, it's going to be served with applesauce, roast potatoes, my specialty, which is you get mushy peas, but not mushy. You get petit pois, put them in a pan, little splash of milk, clove of garlic, blitz them up, and they're really lovely and vibrant and green with a slight taste of garlic and a bottle of wine.
No mince sauce on this lamb. I'm a bit shocked.
No, salsa verde. Salsa verde is nicer because if you slow roast the lamb, it gets a bit of a thicker, fatty taste, and you need a salsa verde to cut through that.
Okay, very nice. Very nice.
Actually,
when are we invited?
I'm looking forward to Sunday now as we're talking.
I'm fasting at the moment. Don't do this to me. It's anyway. So I guess on that note, obviously we thank Charles Archer, our resident analyst, and we also thank you, Anthony Tennyson, CEO of SVNS, for appearing on the podcast and giving us your insights. And thanks very much for your time, Anthony. It's been a pleasure.
Gents, it's been an absolute pleasure. I look forward to staying in touch and maybe coming back on sometime again soon.
Yeah, and on to our next guest now. Kevin caught up with Peter Krugel, CEO of MAST Energy Developments, and this is what he had to say.
Well, Peter, here we are, a year later. We started talking about all of these processes a year ago, and bring us up to date with what's just been announced.
Hi, Kevin. Thanks for that, and good to be back. Yes, we're very excited. We announced this transaction, and we did an interview with you at the end of May. It's a little over a month later now, and we've completed that fundraise transaction. It's been a lot of sleepless nights and working around the clock the past few weeks to get everything done, but we've managed to do it. So the two key conditions to the equity fundraise was shareholder approval, which we've obtained at our general meeting this past Tuesday on the 8th of July, as well as the FCA approval of our prospectus, which we've also obtained now. So, I mean, those were two very big hurdles. We did it in record time. That's done. The fundraise has been completed, and we're in a very, very good position now for the first time in a long time.
Very good. So tell us just the housekeeping stuff. Basically, you're going to have a clean shell after this, I take it, or not a clean shell, but a clean company. No debts for the first time in a long time. You'll be able to sleep at night. And all the money that's coming in from the projects now, even PyBridge and stuff, is going to be cash in the bank then, I presume.
Yes, yeah. So this fundraise transaction, I think, establishes a few very firm footholds for us. So I think first and foremost, it will see the PLC balance sheet debt free. That was an important consideration for us, you know, for many reasons, but also to attract future investment. You know, a clean debt-free balance sheet is always a good position to be in. So that's the one thing. But secondly, and more importantly, it gives us a war chest to advance our strategy to get 300 plus megawatts into production as quickly as possible. So we've spent, you know, very valuable time the past year to solidify and prove our business model with PyBridge. You know, that's a very well-known story. I think because of that, as a result of that success, that's allowed us to do this transaction, because I think it's clear that our business model works. Our partnership with PowerTree is also testament to the fact that our business model works. You know, the likes of them that have been around in the FlexGen market in the UK for almost 2 decades, you know, would have never partnered with us if they didn't feel that we're a worthwhile partner to have. So I think all of those things and all the hard work and sacrifices and play in the past year has brought us to this point where we could do this substantial funding transaction in capital markets that remain difficult, you know, ever expand and solidify our foundation. So we're taking a big step forward now. We're going to follow up this funding transaction with growing our portfolio of megawatts in production and keep on taking even bigger steps.
Very good. So the money that was owed to Riverfort, this means Riverfort is now from a PLC point of view, just becomes a shareholder, I presume. How's that going to work? Because they were pretty working hand in hand with you, but they're now going to be a shareholder with obviously a debt on PyBridge.
Yes, yeah. So Riverfort, the debt at PLC level will be settled in full. They will remain a significant shareholder at PLC, and they've agreed to a hard lock-in of their shareholding for at least 6 months. Which just shows that they're very much aligned with our interests. They're a very supportive shareholder. So that's all at PLC level. And then we've got the finance facility in PyBridge, ring-fenced in PyBridge with them, which will remain there. We're already repaying that from the cash flow proceeds from PyBridge. So that's ticking along very nicely. And we've got the project financing facility with them as well. So, you know, that's another source of funding if and when we get to new sites. You know, they're a supportive funder, future funder as well for future projects.
Yeah, and just explain to everybody also about Paul Venter, the non-executive chairman of the company, what's happened there in terms of full and final settlement for his payments.
Yeah, so Paul advanced critical funding to the company when we very much needed it, I think at the back end of 2023.
That's right, December 15th, yeah.
Yes, exactly. Also, he provided some much needed funding at, you know, very friendly terms to the company, and this is just a settlement of that director loan.
Okay, so again, I think the theme here is that you're going to be debt-free and you're going to move towards now having certainly the 23 megawatts moving. Are we talking about the genset in the third genset in PyBridge being pushed forward pretty quickly now, or are you not sure as of yet?
Yes, so the main focus at the moment, Kevin, is to get as much megawatts into production as quickly as possible, but also as cost effectively as possible. So, which basically just means that for every pound I spend, I want the most megawatts in production as possible. So that's going to be the next step. Now, that might be the third and final genset at PyBridge. You know, that's a further 2.7 megawatts we're talking about. But we also have our Bordersley site, which is 5 megawatts. and which for more or less the same amount of money, along with some third-party commercial debt, we could probably get on stream as well. So kind of just to give you a practical example of how we're looking at this is, we're going to get the megawatt into production not only as quickly as possible, but as cost effectively as possible. That's the focus.
And now that you're going to be debt-free, in some ways, as time goes by, you don't want to be debt-free. You want to probably leverage this so that you can get to 300 megawatts as quickly as possible, and then obviously pay that debt down, because you're going to be making more than the cost of the debt. So how do you envisage that process can happen? And are there already in production facilities that you think you can snap up or buy?
Yes. So I think looking forward and looking at bigger steps, there are larger portfolios coming onto market, and these are predominantly from when the capacity market was introduced for the first time in the UK in 2014. The government further incentivized the large utilities to actually start with the construction of these FlexGen sites by giving them tax incentives as well on top of the capacity market. And I think around, I would say, at least a gigawatt of FlexGen sites, gas peakers specifically, were constructed that way. And those tax incentive schemes are coming to maturity now. So those utilities and infrastructure funds have to sell on those portfolios, not necessarily because they want to, but they have to in order to crystallize the tax benefit. So those portfolios are coming onto market. A practical example of that is the Downing portfolio. Downing, being one of the large energy companies in the UK, sold their gas peaker portfolio of 100 megawatts last year. That portfolio was acquired by Hartree being the JV partner in Powertree, which is our growth capital partner. So they picked up that portfolio. So there is a market of large portfolios, and that market is active and buoyant. So that is certainly something we're already looking at, and a step we'll hopefully get to soon.
Good. So that would propel you into hundreds of megawatts basically within a matter of weeks or months if it was done. Okay. You also said there that there's some sort of investment note coming out in the not too distant future as well for people to watch out for. So can you just give us a little background on that?
Yes. So we felt it necessary, along with this equity fundraise, the share consolidation, the prospectus, to ask an independent equity research firm to do a proper research note on MAST and our business model and our plans. So that's been done. That should be released fairly soon. I can't give any specific details at this stage because it hasn't been released yet, but I think that's something to look forward to.
Very good. Very good. Well, I think everybody needs to watch out also probably Monday, because the consolidation of the shares will come. So I think the share price is going to move from 1.75p to 70p. So you will not be millionaires on that day, by the way. So just watch out for the consolidation. But anything more to say about that? The consolidation is happening. The first few warrants have been issued. I presume that means they're going to start selling into the market. But at the same time, you've also signed a deal with the company, a US company now, which is going to promote MAST in the US. And we should see multitudes of buyers, I would imagine.
Yes, yeah. I think with touching on the consolidation, because I think there is a bit of ambiguity regarding that. So the effective admission date of the consolidation is Monday, the 14th of July. And basically all that's going to happen is the number of shares in issue are going to reduce by 40 times, and the share price is going to increase by 40 times. So on a net basis, the market cap's going to stay the same, but the number of shares are going to reduce, and the share price is going to increase accordingly. So that's the only change that's going to happen. All of that's been explained in our general meeting notice, and a timetable of events has been included in our GM results RNS. So all of that's done and dusted on Monday. And then, yes, as you said, the equity fundraise, the prepaid warrants, the first tranche has been exercised. We'll issue those shares to them. And I think worth noting, and maybe just explaining that under the terms of the equity fundraise, they are not permitted to exercise more than 2.99% of the company's issued share capital at any time. And one of the reasons why that's part of the deal is to control, shares going into the market. So it's not going to be a case, and we see this in large fundraisers, in large capital placings, is shareholders get a large block of shares and they just dump that into the market over the coming weeks, and that has a chilling effect on the share price. Where with us, that's going to be gradual, it's going to be controlled. We've seen similar funding situations in similar companies where there's been very positive results because of that mechanism. And that was one of the attractions for us to this funding deal, is that there's not going to be a dumping of shares into the market shortly after the deal closes.
Yeah, I can see that this process works. It builds an ever-escalating market cap, which then allows you then to leverage that market cap as time goes by to get to where you want to be with the 300 plus megawatts. I mean, and just maybe based on the way forward and how well this is accepted by investors, which it looks very positive at the minute. 300 megawatts actually might be the start of it, not the end of it, so because there is no doubt, and we could go into this for hours, but boy, the UK needs these gas peaking stations, and they need a lot more of them as well.
Yes, absolutely. And, I speak to our growth capital partner, Powertree, on a regular basis, and they are very bullish. The UK energy market, they're very bullish. FlexGen and specifically gas peakers, so I think that's also testament to our view, that supports our view, is that the UK will continue to prioritize and invest low carbon recip gas turbines. I think the time of large scale baseload gas turbines have come and gone. There's certainly not going to be new CCGT plants. I think existing plants will be phased out. But the government and Ofgem have made it clear that they will, even in a net zero scenario, gas peakers will remain in the UK market, because that's just the inherent nature of the UK market. And I think along with that is, and just getting back to your point of the 300 megawatts and, what's going to come thereafter, is once we've reached that 300 on the gas peaker side, we're very much already looking at batteries. I think as technology catches up and as the capex for batteries go down, I think that's going to be a natural second step for us.
So you can put batteries on each one of the sites to hold the use of electric generation that you don't use when peaking is required.
Yes, yeah. So we can either do hybrid sites or we can do standalone battery sites, but batteries very much, I think, a logical next step for us in due course.
Yeah, and then just release that when it's required, obviously, the electricity. Very good. Well, I'm genuinely extremely pleased that you've been successful, especially as I tipped your share at the start of the year at 0.17. So it's now 10 times what it was then. Let's hope it can keep going. And I think genuinely it probably will, to be honest, on the basis now that your hands are free. I used to get frustrated even for you because I think your hands were tied for a long period of time. But now you can use those skills that you've learned over the period of time now to build this business into something that everyone will be very happy to own.
Yes, agreed. Yeah, no, it's been hard yards, Kevin. I'm going to be honest, but I think the hard yards are over now. We've got a very solid foundation, and we're very excited about the future. We're already ready with a pipeline of deal flow, and we're looking forward to updating the market with those events in due course.
You can stop being the number 8 now, and you can be the number 15 instead.
Exactly.
Though you are more suited for the number 8, I have to say. Having met you personally.
Yeah, just on that point, if we just go on to a lighter topic, is I've heard that they're talking about hybrid players now, so players like literally playing 2 positions. So maybe I can be a 15 and an 8.
You could be the quarterback.
Yes.
Indeed. Right. Well, good luck anyway, and I expect that we'll be hearing from you in the not too distant future as well, and spreading the word about how we're going to get to this 300 megawatts in quick time.
Yes, good. Thank you so much, Kevin. Looking forward to the next one.
Let's move on to our third and final guest this week. We're delighted to be joined again by Charles Ray, Chairman of ATN. Welcome back to the podcast, Charles. How's life?
It's very good, thank you. We're very happy.
Excellent. Yeah, I mean, obviously, we saw news this week that the company has confirmed a high-grade lithium mineralization at its HCK project in Rwanda, following a successful initial drilling campaign with standout results, including 3.5 meters at 3.2% lithium oxide. The project, under joint venture with Rio Tinto, has now seen Rio exercise its stage 1 earning right to take a 51% stake, with the option to increase to 75% through a further $7.5 million in exploration spend. Drilling on just 2 of the 12 defined targets intersected multiple spodumene-bearing pegmatites, some up to 80 meters in width, revealing strong development potential. The scale, continuity, and fresh pegmatite grade suggest the HCK project could emerge as a significant lithium discovery in Africa, especially with Rio Tinto backing further exploration. Sounds very positive, Charles. Just tell us more, please.
Yeah, I think the highlight of the exercise, the results, was Rio Tinto told us about the 3.2% grade for 3.5 meters. That's particularly strong. And so we were very, very excited to hear that. That was very positive. I think what was somewhat, and I hate to jump right on the negative early on, but I need to stress it, is HCK2 drill hole where we didn't get anything. But I think what it speaks to more is that we need to drill more. So we had some amazing intercepts. We found pegmatite across all 4 of the, or I should say 3 out of 4 of the drill holes. And that's really what we're looking for. And because don't forget, for our shareholders, this is a tantalum, tin, and lithium play. For Rio Tinto, it's a lithium play. So for us, it's much more about having a broad drill campaign and making sure we understand what the byproducts are relative to Rio Tinto, of course. And for us, understanding, one, that spodumene is there, that it's a very high quality spodumene, that it's not as deep as they're finding in other parts of Rwanda, and that it's part of a system that we believe demonstrates that Rwanda is a lithium province in and of itself. So very exciting times.
Yeah. So if we look at those numbers you just alluded to, 3.45 meters intercept grading at 3.2% lithium oxide, how do those grades compare to, any known lithium deposits globally? And what does that say about any potential commercial for the HCK project?
I think to put that in context, grades over 1.5% of lithium oxide are generally considered high quality across the globe. So 3.2% is a real highlight. It's demonstrably strong. And also, I think one of the issues with what we learned, and we're still going through everything and understanding what it all means, is our understanding of the dipping, or the way the pegmatite lays in the ground in this particular area kind of ran, I don't want to say opposite, but more, I'd say, counter to what we anticipated. So what that means is we need to do more drilling, because we suspect that if we come at it from a different angle, so to speak, we're going to find similar sorts of grades and potentially similar sorts of intercepts. So we're very excited, and it means that this is part of something that potentially is pretty big. And to address the kind of elephant in the room, these results are relatively late, at least from what we were anticipating. And what we've also determined internally, Tyrion, is that we suspect Rio Tinto has been working on other projects nearby, and those projects are producing good lithium results as well. And so it's about understanding now, how does HCK1 fit in across a broader spectrum or broader portfolio of spodumene lithium assets, and what's it mean to us? Because ideally, and we've talked about this before with you, the ideal situation is we get this back at this point. Yeah. So.
Yeah. But I was going to ask you about that, because obviously, Rio have now exercised this stage 1 earning to take this 51% stake. What does that say about their kind of commitment and interest to the HCK project at this point? Are you surprised that they've now pushed it to exercise that stage 1?
We're not surprised given this intercept result. What we are curious about is again, the portfolio approach. What we're kind of getting indications of is that Rio Tinto has found that lithium exists in Rwanda, that it is widely dispersed. And I don't mean that it's everywhere. What I mean is more that there are probably several sites that have good lithium reserve potential. HCK is one of those sites. And so how does it fit in with the rest of that portfolio? Does it fit in? If they were to approach a kind of a hub and spoke model in terms of developing these lithium assets within Rwanda, does HCK1 fit in with that? Is it something that will be secondary? Is it something we can convince them that we should be operating and they should focus on, that one other site or two other sites? So it's going to be an interesting couple of years, I think, as we advance these assets.
Mm. And only 2 of the 12 identified targets have been drilled according to the RNS so far. So, what are the next exploration steps planned? And, what is your timeline for advancing HCK towards a, maiden resource estimate or scoping study at this point?
Yeah, that's it. I think we're going to push to have the balance of the site drilled. And I shouldn't say but, there's a formal process that we have to go through as part of the management committee in terms of making certain requests. But given that, I don't know if you noticed this as well, but Rio Tinto has spent about $4.5 million so far on this project. So we're very, very pleased with that, because in every circumstance that just adds to the value, it adds to the data. We're able to take that data, we're able to work with that data already. And so from our standpoint, we're learning a tremendous amount with some very, very valuable data, and expecting that Rio Tinto will work with us to drill those other sites. Yeah. And so we're going to make a strong push for that. And if they don't want to do it, we're happy to do it. So then it's about making sure we have the capability to advance the asset under any circumstance.
So it's an interesting thing. Rio Tinto came into a new country and have now got multiple assets, probably two at least, as we know, in the lithium space. Do you think they're going to spend all this money and not actually generate any lithium at the end of the day?
That's a great question. I personally have not ever run a multi-billion-dollar company, 40 billion or so. So I can't tell you how their mind works. However, what I can say is, no, it doesn't make a lot of sense, does it? Right? You'd expect that, given their push into lithium, which we fundamentally believe in over the medium to long term, we truly believe that battery usage is going to expand dramatically across all different types of applications and fields. And so lithium in and of itself is going to be fundamental to that, as it's just readily available resource once you make the capital investment. And what you're describing is Rio Tinto making that capital investment, coming into a country, partnering with not just us, which we appreciate and very much value, but partnering with a country. We helped in that regards. And I have to say, it's not the easiest process, but Rwanda has been remarkable in its openness and willingness to demonstrate that it has its own natural resources. Their capabilities are becoming known, and their assets are becoming known. And I think what you're going to find is that a company like Rio Tinto goes into someplace like Rwanda because they understand it's a good working and investment environment with lots of potential natural resources. That's the bottom line.
We stood on HK1.
Yeah.
And where were the drill holes then that actually have come up with the spodumene?
Okay, so I don't know if you went to the very top sort of the hill.
We did.
Yeah.
If you remember,
we looked out over to HCK2 at one point, didn't we?
Yeah,
Yes.
HCK1, we stopped the cars, if you remember, and the geologist from Rio showed us the sort of empty spodumene, if you like.
Yes. Do you remember that where that shack was at the top?
Yes.
Yes, that's where one of the drill holes was. And then the other was approximately, I want to say about 40 meters away from that. And it was in what I would describe as kind of a scissor formation.
Okay. And at what depth did they find the spodumene?
That was anywhere from about 100 meters. And if you recall HCK1, the elevation was approximately 100 meters.
Yeah, I was going to say, so basically the hill itself has maybe not got spodumene in it, or might have some, but as you go further down, it's got spodumene, you think?
Yeah, what we think, and this is from our geologists, not from me, because I have no knowledge of the subject really, but our geologists tend to think that what's happened is there was a lot of weathering at the upper levels. They think that the geological features of HCK1 allowed for, effectively, to put it in layman's term, a lot of rainwater to leak into HCK1, and at the hillside, the top level, the spodumene was effectively, the lithium was effectively leached out.
Yeah, just washed out. Yeah.
Yeah. So at depth of approximately 100 meters, you start to get lithium signals and start to hit spodumene.
And we don't know how deep that goes, then it could just keep.
No, we drilled to 100 and we drilled both of those holes to approximately 250 to 300 meters. And with those, once the intercept was made, there was fairly consistent off and on spodumene, or I should say pegmatite intercepts. So we think the pegmatite does extend to 300 meters approximately.
Okay, very good. Okay, so the other projects that you've got within ATN, then we've got the potential for silver and copper in Morocco, and yes, we've got the copper license and gold, and we've got copper licenses in Botswana. So in a couple of minutes, tell us how wonderful they all are.
The Moroccan assets are, we think, phenomenal. We think that ultimately what's going to happen, and it's starting to accelerate. We're starting to see it. In the last conversation, we mentioned this as well. We're seeing more and more mining industry professionals enter into Morocco. We're seeing more and more licenses picked up. What we're seeing is also more and more interest from third parties in terms of partnerships to understand the geology. And what we think is going to happen is that Morocco will be deemed a mining destination, much like Botswana, because it has the infrastructure, it has the power and road infrastructure, it has water, it has just everything. And most importantly, it has the legal system. And so we believe that these assets, Azrar in particular, we think, which is sedimentary hosted, we have a strike length in excess of 30 kilometers there. We have drilled targets in 3 different areas. The one that's most interesting, as I just mentioned, has shown signs of gold, it's shown signs of silver, and it's shown extensive signs of copper. And so for us, it's about finding a partner, or how we'd like to approach it. We don't need to, but how we'd like to approach it is to use our model, find a partner with deep pockets who's willing to share in the upside with us and who's willing to drill this out. And so what I can say is those discussions are underway. We're excited to have Azra eventually drilled out. We have drill targets at Agdes. Agdes is where we had a very healthy silver intercept in copper from 8 meters depth. So the Agdes is very exciting. We have drill targets there. We in Botswana have 7 licenses in the Kalahari Copper Belt. These we have targets as well, but they're a little earlier stage. And there we're looking for partners to help us in terms of doing some geophysical work first, but also then firming up the targets. And we're working with a group now to help us utilize the data we have with some AI and machine learning to eliminate potential targets. And this is something that we're excited to be working on. It's with a group out of Silicon Valley in the UK. And they've been most impressive. You know, these Cambridge and Imperial College scientists are pretty clever. And so we're excited to help them, to help us to eliminate potential areas where we feel that the AI and machine learning has designated that it's not necessarily a target, even if we in our first instance think so. So that's a process, and there's a lot of learning that has to happen there in terms of exchanges of information, but it's exciting. So Botswana and Morocco, both very, very excited.
Okay, Charles, we saw some interesting news, I think at the beginning of June, where basically Tether acquired 37.8% of Elemental Altus, one of your obviously significant shareholders, which potentially brings about $5 billion plus of annual crypto cash flow into mining royalties, which could, transform the sector capital. So just talk us through how significant this news is. And I guess the market really hasn't woken up to this yet, right?
No, they haven't, not in the slightest. I personally think this is the single, since I've entered into this industry, this is the single most exciting event to happen. And I say that not just because we have a shareholder, a 20% shareholder who now is effectively controlled and owned by Tether. It's also because this industry, I think, in particular small cap, and this is where I think the investors and your listeners, please should pay attention. The small cap mining space has been decimated over the course of the past 3, 4, 5 years with a dearth of capital. Now Tether has come out basically and acquired a company in the space and has stated publicly that they are going to deploy capital into this space because they want to not only be a digital asset provider, they want to be a real world asset provider. And I think all the signs are there. You just need to read and pay attention and look. And please, I recommend to all your listeners that they go and check out what Paolo has to say. I think what they'll find out is that all of a sudden there's a new player in this industry who wants to be investing at these small cap levels and diversifying a portfolio so that, should anything happen in the crypto space, they can have a stream of income coming out of the real world, and that's starting with gold royalties. And I think that's what you see with the Elemental Altus acquisition.
Yeah, it's scary, exciting, really, to be honest with you. I mean, I've got a question. If Rio Tinto offered you the market cap now, which is 4.5 million quid for the full project in Rwanda, would you take it?
No, we couldn't.
Okay.
We think that if Rio stays involved, obviously the value is way more than that, right?
Yeah.
And this is the perverse thing. If Rio doesn't stay involved,
it's even more.
It's obvious the value is way more than that. And so, we struggle in this space sometimes, but we get by. What we do is we try to develop strategies that allow us to continue to invest in exploration and to not become dependent upon shareholder and shareholder capital. We think the market has started to turn. It's started to become a bit more positive. We're excited about that. We're starting to see buyers in the stock. We're starting to see buyers across the small cap space. So there's little green shoots, and that's exciting and hopeful. It still doesn't negate that we are significantly undervalued in our estimation. And I have to say, as is most of the market.
Yeah. It's not just you. We will go on, as we recorded it before, we were recording this with you, but we will go on to talk about the fact that many stocks, hundreds of percents undervalued, not just like a little bit. I mean, the reality is, if you add up the cost of all the licenses in Morocco, how much you would sell them for if you just sold them as licenses, how much you would sell the licenses for in Botswana, how much you would sell the licenses in Rwanda. And I mean, we've had conversations. You've got very good relationships in Rwanda now about potentially getting other deals in Rwanda as well. But ignore that for now. And then finally, the trading, which is my last question, really, I'm coming on to. Will the producers finally some income that you can then fly us to Rwanda again? We can go and see what's actually going on again. And we'd also love to go to Morocco and Botswana, because I do believe that what you're creating in Tyrian, even though nobody actually sees it yet, is an extremely valuable company. Your net asset value must be way higher than your market cap, like way higher.
That's the idea. That's exactly the idea. And to talk about trading trading started off slow. Trading has then accelerated its progress. However, it's still a bit slow, but we are very, very pleased. Our partners are pleased. We're starting to make what I describe as the large scale container deliveries on a regular basis. And so what we have planned is to start making announcements about deliveries. So, we'd ask all your listeners, shareholders, people interested in trading to just please hold on just a little bit longer as we start to make these deliveries and start to talk about that.
Good. No, I think you're a screaming bargain at the minute, and good luck with all of these different things. I mean, I think the tether thing, I think the ability for Altus to come to you, because you do speak to them on a regular basis, as you've said to us, and say, we want you to go and find X, Y, Z, as well as advance your own projects, is extremely high. These guys, there's only so many projects in the world, and these guys need to push the money somewhere.
Yeah. And they're a very professional crew, this Elemental Altus. So we're very pleased to have them as a shareholder and hoping and looking forward to working with them.
Yeah. And that royalty and streaming model, I guess it avoids the direct operational risk that comes with mining. So it's a win-win for them.
Yes, it is for them. It really is. There's, in my view, there's still some operational risk, but it's one stage away from them. And from a portfolio perspective, as an investor, it still makes sense, I think, to have a bit of royalty income in your portfolio.
Sure. Okay. Well, on that note, we'll say Charles Bray, Chairman of ATN, thanks very much for appearing back on the road.
Thanks. Yeah, great to see you guys again.
All right, let's move on to the movers and shakers of the week. The best mover of the week is PREM, Premier African Minerals, up some 100% after providing an update on the Zulu mine with the installation of spodumene float section inserts complete. One we've talked about in the past, Kev. It did 100% in a week.
I can only laugh. It's like it's probably not even going to be economical if they produce the lithium, the price of lithium at the minute. So it's just absolutely bizarre.
Yeah.
But anyway, good luck to anyone who holds PREM.
Yeah.
I hope you bought some more down below and made 100%. But it's just, for me,
is it just becoming a trader's dream on that? I mean,
I just don't get it. I mean, even if he gets it going, I don't see how they're actually going to make any money. But I mean, maybe I'm all wrong, and maybe lithium price is going to double, treble in the next couple of years, and PREM will be superstar. But I just don't see it. But anyway. Yeah,
okay. Next one, Wishbone Gold up 90% after announcing it has applied for 12 new exploration tenements totaling approximately 174 square kilometres over ground that the geologist identified, which is proximal to the company's Red Setter Gold Dome project. I think that one's been beaten down quite a lot of late, hasn't it? It's quite a low cap, so I think that was almost justified, that rise of 90% in terms of those new 12 tenements.
Yeah, I think so. But Wishbone's up like 500 or 600%, I think, in total in the last few months, and from what I can see, and it hasn't got much more than a lot of the other ones that could do exactly the same thing. I mean, I was talking about East Star Resources about to drill as well with much bigger opportunity. The difference is obviously Kazakhstan. I think Wishbone is Australia, isn't it?
Yeah.
This is the difference, isn't it? But at the same time, I think East Star could do something similar. We think Bazant should do something similar. African Pioneer could do something similar, as in hundreds of percent, and it still would not be expensive. I mean, I did the maths yesterday. African Pioneer could 10 back and still probably be only worth a little bit more than the license at Ongombo. And it has also assets in Zambia with FQM, First Quantum, and also assets in Botswana as well. So it's absolutely bananas. The price of some of these are literally bananas, and we've also got Power Metal in that equation as well. Power Metal now is way below its NAV, its NAV. It's been going great guns. If that license comes, it's going to pop. I think it's going to pop to £1, to be honest, if that license comes. And we were speaking this week, if you remember, not in a podcast, but we were speaking with Tristan from FDR, which is the next one. The documentation came out on, I think it was Friday, to say that they're going to be listing, and that's another rollout from POW. So anyone interested in that, give us a shout as well. I think there's still a little bit of money left on the IPO, but effectively I think it's going to be Australian gold asset, and they're going to drill it. If they find it, it's going to be worth a lot of money. So Power is it was one of my picks at the start of this year. It started to get some traction this week, but still crazy undervalued. crazy undervaluation.
Yeah. Myriad were up 60%, which was they had an interesting move up to this sort of 0.02 mark, which is, came out of nowhere really. Again, there was no news driver on that one, but I think no news driver on that one. Then AFP, as you just said, African Pioneer had a good finish to the week, up some 44% on Friday. And then the biggest shaker was Petromatad. That was down some 38% on news of a discounted retail offer.
Yeah, they raised, didn't they?
Yeah, so copper shipments, obviously copper, a good week for copper. That there was a surge in the price of copper ahead of a looming 50% import tariff imposed by Trump, triggering a scramble to beat the deadline and straining global supply. Traders are pulling metal from warehouses and fast-tracking exports, causing copper spot prices on the London Metals Exchange to spike with a 39% premium, the highest since 2021. Analysts warn the tariff aimed at reviving US smelting could disrupt global flows and create long-term market imbalances. So obviously interesting to see that. I mean, what do we make of the fact that US consumes twice as much copper as it produces? What will that tariff do to them, other than punish them, in my eyes?
Well, I mean, you've hit the nail on the head. It's going to do nothing but punish them, isn't it? I mean, you probably got copper mines going to come online in the US, but that's going to take years. It's not, I mean, even if they get past this ridiculous licensing approvals and everything else that they've held up for decades, literally, it's still going to take years for that all to flow through. And it bodes well, I think, for, the high grade copper that is in Zambia, that is in Botswana, that is in Namibia, that we've just, that I already mentioned. You got Bizant, should be in production within sort of 6 to 12 months maximum. You've even got East Star Resources, could be in production that quickly as well. You've got African Pioneer in Ongombo. I mean, how much is Ongombo worth now? It's with that thing, it's just gone up, surely, in value. Yeah. You've got GMET with copper as well, and potentially also with the other projects that they've got. And yet we've seen across the board, I think, that precious metals are starting to go again, and I don't see any difference. Tell me about Bizant. They had an update in the week related to the Mankayan project with Blackstone, where they announced that they basically high-grade copper gold surface delivered new targets at the Mankayan project, and they also the completion of that 22.6 million Aus dollar placement, which is approximately 10.8 million. What do you make of that news? Firstly, not only of the new gold targets, and also the fact that they raised their quite a decent one. Yeah, well, Mankind was always a good project. I mean, when we spoke to Colin in the past, he was always very bullish that it was a good project. The problem is they only had, I think, 23% of it, was it? Or either 23 or 29%. So they were always going to be a passenger. So basically they changed passengers, haven't they? They've basically changed passenger and put it into Blackstone Resources now, who've just raised a lot of money, as you've just said, to now put into the ground to make it work. So those Blackstone shares, in my view, are going to keep going up in value probably over the next while. The results were great. There's probably going to be a bit of churning going on over this raise, but once that is out the way, then I can see Blackstone shares, certainly probably being over $1, and that will put Bizant in a great position then to probably shift those shares and get themselves, 6, 7, 8, 9, 10 million US dollars, which they don't need that much more than that to actually advance the Hope and Gora project. This week there was also, a few warrants. I think.
I think that almost killed a bit of the momentum.
It did.
Really, unfortunately,
they were. I actually spoke to Colin, and they were Shard's warrants. Okay, so Shard, who was the one who did the last raise. They were their broker warrants. They cashed them in, sold them off. So it's done. I think there are warrants to come at 0.04, and there are a lot of warrants at 0.025, I think it is. But they're with Sanderson, and Sanderson aren't going to be cashing them in anytime soon. It'll be plenty of room for them to go ahead and do it.
Yeah.
But I mean, it comes back to this whole copper thing, right? If we truly are in a time where copper is going to be good, we've got Bizant, we've got East Star Resources, we've got African Pioneer, we've got Galileo, we've got Extract, we've got Jubilee Metals, and probably the one that should respond the most purely because of the amount of production they've got right now is Jubilee Metals, in the short term, but we haven't seen any response whatsoever.
No,
but the upside for Kazan East African Pioneer, in my view, is hundreds of percents, because the valuations just don't add up. And yeah.
I want to talk about the FTSE. The FTSE is footloose, as somebody said I think it was an analyst from Hargreaves. I mean, it hit record high of 8975.66. Obviously supported by, one of the main reasons was obviously, as you just talked about, is there's the miners, the mining stocks, supported by strong performances from the likes of Glencore, Rio Tinto, and Anglo American, even amid, as we've just said about these Trump tariffs, which ironically, I think the market is not thinking that is taking the taco stance. Trump always chickens out, because I think, as we've just said, the US could not impose tariffs on copper of 50% when it relies so heavily on imports of copper for it. And you're not going to just turn on copper mines and enable that to happen. So I think the market is thinking that a lot of these tariffs are not going to happen. That's my view on it anyway.
Yeah, I think even if they do happen, there'll be a lot less than they are talking about now, and things are going to be happening. The reality is that I believe that the small caps and a lot of the small cap miners that we're talking about in terms of resource space is that at this level of copper price, or this level of gold price, when we talk about Greatland Gold or any of the other ones, and we've even seen with GMET tungstens continuing to rise in value as well, then they are massively undervalued. All of them, even the ones that have done well so far. We've seen silver also go on a run as well. We've seen silver hit $39. I mean, we talked with Rick last week. He reckons $250 is possible if we really go on this run. And, we can't leave today without talking about Bitcoin as well. I mean, you got Bitcoin.
I thought we were going to get away with a week without mentioning treasury and strategy plays.
$117,000 a Bitcoin. We caught up with Nick from Hammock, and basically it's very interesting what they're trying to do. Going to be a much more of a corporate play, I think, where we're looking at trying to get big money from pension funds and from institutions, as opposed to just the general public, if you like, or just the investor public. So I'm quite intrigued by that. And the last thing, I suppose, if we go back to our first interview, when we talked with Anthony, they announced on Friday the raise. They raised £1 million from 3 existing investors, just so that they can get the thing going even quicker. So from an investment point of view, they had a good day on Friday, but I think that's got absolutely mega potential to go significantly higher, a lot higher. The guys in the board have got warrants at 0.73, and I think we're sitting at 0.34. So, for me, the potential to go 2, 3, 4, 5 times higher, even before we get any okay from any of these drugs, I think is there.
Yeah.
I don't know about you. What do you think about it? I mean, obviously you've gone on the sobriety route in the last couple of years, but for me, I think the actual potential clientele for this type of thing is just vast, much bigger than even he's talking about.
Yeah, I mean, what interests me is the fact that they're using this. I mean, when you just said on the interview, this ketamine-based treatment, where it was almost like, I've heard of them refer to people going down a K-hole before, and this kind of this out-of-body experience where they almost see themselves in this position, and it makes them it's like shaking them and gives them a wake-up call of, look at the position you're in, and with the right therapy. I mean, that just sounds incredible to me. If they can pull this off, and from what the results that we've seen so far from this NHS, from these phase 3, it does look like the results are getting there. It looks like it's going to be. One thing about the raise was that they got the investment from, I think it was their largest and longest standing shareholder, from what I can see, and this is all down to kind of accelerating their proprietary AI supported discovery platform, which again is I mean, how hot topic is AI right now with all these companies? So it's all there, and I think it looks really, really good. So yeah, watch this space on Solvonis.
Yeah, I had a good chat with Anthony Friday as well, Friday afternoon. So I think there's lots in the pipeline that's coming. So yeah, I think it's definitely one to get on your watch list anyway, because I think it could do very well. And again, just to repeat, the last one that I think really has a good shout is Power Metals at the minute. With FDR coming online, hopefully we'll have Tristan on in the next week or so talking about what they're going to plan to do. But when you look at that stable now with GMET, FDR, the uranium drilling in Shawetsk, or however you call it,
Saskatchewan,
even that one in Canada, you know, the potential that it's only worth about 15-16 million quid when they've got these things coming is just a bit bizarre. So I think we're going to have a good run, and I'm coming to London next week, so hopefully I'm going to meet Oliver, Sean, and Tristan next week. So yeah, I'll give you any updates if we get any news.
Cool. Okay, so yeah, I mean, obviously last week I alluded it was the season finale. We lied, or I lied, and this is obviously the season finale. So we're going to
maybe you lied again.
Well, no, that's it. I've got lots on, mate. I've got a summer of busy schedule ahead. So we'll be doing obviously the midweeks on the reactionary RNSs in the week for companies, but the roast's going to take a well-earned break, and we'll be back in September. So anything planned for the summer, Kev?
Not really. I'm in London next week, and then going to be going on the beach for 6 weeks, I think, and doing podcasts hopefully from that. The market is actually very, very busy, and I haven't been as busy in probably two years, I think, in terms of talking to CEOs. And I think liquidity is returning, isn't it? Liquidity is returning. Definitely. And we're seeing that by our 3 guests this week. You know, Sylvanas, great opportunity. We've seen MAST. Look at all the liquidity that's coming into MAST and how well that's done this year. And I think there you go. You've got Ethereum, and I think honestly, any liquidity drops into that stock, and it's gonna do incredibly well. So you know, it's a ridiculous valuation as well. 4.something million pounds for what they've got. You heard the CEO said he wouldn't even take that from Rio if they wanted to buy out the project. It's like Rio have spent more on one of their projects than the market cap of the company. What does that tell you?
Cheap. Okay, well, thanks for listening all. If you do like what you've heard, please do subscribe, hit the bell icon for future notifications of further episodes, and have a great summer, and we'll be back in September. Have a great one.
Yeah, enjoy your time, guys.
This podcast was brought to you by Roast PR Limited. If you would like to appear on a future episode of The Sunday Roast, please email admin@thesundayroast.net.